will begin this session with information on stroke, and then we will move on to cover heart disease. Stroke is the 5th leading cause of death in the United States and is a major cause of serious disability for adults, according to the CDC. Stroke is a prolonged or permanent blockage of blood supply to the brain, resulting in brain tissue death and damage or loss of body function. TIA, transient ischemic attack, often called a mini stroke, is a temporary lack of blood flow to the brain. There is no permanent brain tissue damage or loss of permanent body function. The occurrence of a TIA may be a warning for a full-blown stroke ahead. The symptoms of a stroke and a TIA are the same, but the outcomes are different. Signs and symptoms may include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Sudden severe headache with no known cause. Stroke.org. Here is how the symptoms differ from the general population and what women report. Women may report symptoms that are different from the common symptoms. They may include loss of consciousness or fainting, general weakness, shortness of breath, confusion or disorientation, sudden behavior changes, agitation, hallucination, nausea or vomiting, pain, seizures, hiccups. These unique symptoms create a problem because they are often not recognized as stroke symptoms, and treatment is often delayed, according to stroke.org. Risk factors associated with stroke include age. Having a stroke increases with age. Family history. If your parents, grandparents, or siblings had a stroke, this puts you at greater risk. Race. African Americans have a much higher risk of death from stroke than whites. Gender. Women have more strokes than men. High blood pressure. Diabetes. Obesity. Hardening of the arteries, which is a collection of plaque, fat, cholesterol, and other sticky material in the heart and other arteries of the body. Prior stroke, TIA, or heart attack. We know that some risk factors cannot be changed, such as age, race, family history, and gender. Some risk factors may be prevented, changed, or improved upon with treatment and/or lifestyle change. To reduce your risk for stroke, maintain a normal weight, eat healthy foods, get active, exercise, take a walk, do some yoga, maintain a normal blood pressure, control your diabetes. A normal hemoglobin A1C is below 5.7. Avoid smoking or current exposure to secondhand smoke. If you think you are having a stroke, call 911 immediately. Be fast is an easy way to remember the common sign of stroke. When you spot these signs, call 911 for help right away. B is for balance. Is the person suddenly having trouble with balance or coordination? E is for eyes. Is the person experiencing suddenly blurred or double vision or sudden loss of vision in one or both eyes? Face drooping. Does one side of the face droop or is it numb? Ask the person to smile. A. A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift down? S. S is for speech difficulty. Is the speech slurred? Are they unable to speak? Or are they hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? T. T is for time to call 911. If the person shows any of these symptoms, even if the symptoms go away, call 911 and get them to the hospital immediately. Now that we have covered stroke, we will discuss heart disease. Heart disease is the leading cause of death in the United States. The term heart disease refers to several types of heart conditions. The most common type of heart disease in the United States is coronary artery disease, CAD, which affects the blood flow to the heart. Decreased blood flow to the heart can cause a heart attack. A heart attack happens when a part of the heart muscle does not get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage to the heart muscle. Death may occur, according to the CDC. The symptoms of heart disease include palpitations, fluttering feelings in the chest, shortness of breath, fatigue, swelling of the feet, ankles, legs, abdomen, or neck veins. See your doctor for evaluation. Unlike heart disease, which may get progressively symptomatic over time, a heart attack is a medical emergency and requires immediate attention. Call 911. Signs and symptoms of a heart attack include chest pain or discomfort, upper back or neck pain, indigestion, nausea, vomiting, extreme fatigue, dizziness, and shortness of breath. There are several risk factors of heart disease. The leading risk factors of heart disease are high blood pressure, high cholesterol, LDL, diabetes, smoking, overweight, obesity, prediabetes, unhealthy diet, lack of physical activity. If you are experiencing symptoms of a heart attack, call 911 immediately. Stroke and heart disease are serious diseases, and if left untreated, serious complications could arise. We believe with the right information, early screening, service linkage, and support, we can make a difference in improving health outcomes for heart disease and stroke. If you have any questions regarding these topics or are currently looking for resources to prevent and manage heart disease or stroke, please give us a call at the Starr Health Center. You will receive information on heart disease and stroke. We offer individual risk scale assessments. You will have a confidential baseline health assessment, including blood pressure and weight measurements. Participants will be provided with counseling and recommendation for follow-up. You may also be linked to one or more services to support self-management and prevention of chronic diseases. These services may include individual health counseling, virtual exercise group, yoga, and much more. You will also have the opportunity to join a community-based chronic disease support group. I would like to thank you for taking time to watch our video on stroke and heart disease. If you are experiencing any of the symptoms above, please contact your primary care physician or proceed to your nearest emergency room. If you would like more information or a free health screening, please call us at the Starr Hill Health Center, 434-984-6220.